driving a car, reading a prescription bottle, watching television, or reading a book. These are activities that we all take for granted every day. But what if you couldn't do them anymore? What would that do to your independence? Millions of people face losing those abilities because they did not notice the signs of vision loss. Are you one of the 61 million adults in the United States who are at high risk for serious vision loss? And are you one of those who hasn't seen an eye doctor in over a year? Stay tuned. This program will enlighten and educate you on the vision loss signs to look for and how ophthalmologic surgery may be the answer to keeping your independence.
Hi, I'm Laura York. Vision loss causes a substantial hardship for millions of Americans, from social to economic problems. It can include significant suffering, disability, loss of productivity, as well as a diminished quality of life. What you may be surprised to learn are that some of the best eye care specialists in the nation are right here at Memorial Hospital of Tampa.
And in the next 30 minutes, I'm going to introduce you to 3 ophthalmologic surgical patients and show you how ophthalmology services at Memorial Hospital of Tampa offers the latest techniques, technologies, and clinical trials available while providing that personal, individualized care you get at a community hospital.
Some vision issues, if not recognized and treated quickly, can result in permanent loss of vision. Memorial Hospital's Chief of Surgery, Dr. Ivan Sunir, specializes in retinal surgery. His patient, Janet Holt, an avid sports fan, was facing that situation with a family history of retinal detachment.
I have a history in my family of thinning of the retinas and detached retinas, and pretty much everybody in my family wore glasses or contacts. So I was born severely nearsighted, so I knew that I had some issues to look out for, and my vision had just really changed a lot in the last few years, and I had been watching the thinning of the retinas, and they had told me to watch certain signs in case of detached retinas. And sure enough, I started seeing the black curtain that starts to go across your eye, and knew I needed to call a doctor.
Well, Janet is a very interesting young lady. She's about 50-year-old, very active, very interested in sports. And she presented to our office with the new onset of a bunch of floaters, black spots, as well as flashing lights. And these progressed to then create a curtain over her vision. And so at that point, she became very concerned, came to see us, and sure enough, she had a retinal detachment. And many people, what will happen is there's a gel that fills most of the inside of the eye, and that gel will liquefy at some point in time. And when it liquefies, it'll peel off the very delicate surface of the retina. And the retina is a very delicate structure. It's about 1/4 millimeter thick, and it's what accounts for vision. It's like the film in a camera that takes a picture. And so when this gel peels off, there can be very strong adhesions, and as it peels off, it can rip the retina. And so if the retina rips, then fluid gets underneath it and detaches it, and that can actually lead to blindness. And so she was very fortunate. She came in right away. And one of the wonderful things about Memorial Hospital is we are able to get access to the operating room fairly quickly. And she was lucky enough to have surgery that same day and had a great outcome. Interestingly enough, she ended up with 20/20 vision in that eye, which could have been blind. And within 4 months, the other eye detached as well. And that one's done very well also with 20/20 vision. So she is actually a very fortunate lady. She's now back to her sports, enjoying them both on TV and going to the Rays games actively herself.
Actually, I wasn't aware that there was state-of-the-art technology in Tampa. I had been going to Miami to a well-known large hospital there, thinking that I needed to go there for the type of treatment that I needed for my eyes. And all along, I could have stayed right here in town. Everything that I've had done to my eyes in the follow-up care has been done at Memorial, and I have had no need now in the future I've never made another trip to Miami. I've never had to go anywhere else. So all that time I didn't even realize that could have been done here. I wish I would have known that sooner.
I have the luxury of training at some very prestigious eye institutions where they're dedicated eye hospitals. But what I find particularly wonderful about Memorial Hospital is it's a small community hospital, but the emphasis is on customer service and patient care. And so from their perspective, they're the only one taking care of that day. They're the ones focused on surgery. From the physician's perspective, they have the most up-to-date equipment available for us to take care of our patients. And so I think it's a perfect combination of customer service for the patient, but then also having advanced technology for the physicians, all in a small community setting. We have more best doctors in America, ophthalmologists, than anywhere else in the whole Tampa Bay area. So I think it is really a center for excellence, not only in ophthalmology, but also in medicine that's right in our community and available to all of us. It's very easy to get a patient into surgery, especially in a case like Janet's where time was of the essence. And able to get her in the same day was a huge impact on her eventual outcome and her visual success.
I mean, something with your eyesight, if something comes up, it's pretty urgent. It's not like you can wait 2 months out to get to see the doctor of choice. I think that, of course, was very important to me. And I like that just the diagnostic centers, all the different doctors that I've gone to at that hospital, at Memorial, are within really probably like a 2-block range of Memorial. And that I really like. But I think, again, just the feeling of that they know you, they kind of know your name. It feels like a local hospital, but yet you can get all the testing and everything that you can think of done there.
Janet actually now is back to normal activities, back to enjoying the rays and all her sporting events. One particular benefit for Janet is she did happen to have cataracts at the same time as she had the detachment. And so she was a very high myope or very nearsighted, needed very thick glasses. Now she can go about her life without glasses and just uses them for reading. So I think the quality of her vision has improved as well as the stability in her vision as well.
Probably first of all, and the main thing for me, especially at my age, is not losing my driving privileges. My eyesight was so bad that when I went for driver's license renewal, they were not going to renew my license. So I waited until I actually, since I wasn't going to be able to drive after my surgery for quite some time while it was healing, I waited to go back to do the testing until my eyes were healed, and then I was able to get my license. But it really, I mean, losing your driving privileges, you know, in your 50s is, I mean, at any age, I understand why elderly people feel so shut in and feel like life has really changed, because you don't realize how dependent you are on someone when they have to drive you everywhere. So that was the main thing for me, that I could drive again and I could actually see well enough that I was not concerned. I mean, I was concerned about my own safety and what I may do to others. So that was the first thing for me. Secondly, of course, is my love of sports. Obviously, coming to the Rays game this evening, I'm able to see the scoreboard again. I can see the ball. Playing golf was not fun at all. I just played golf again this past weekend. So those two things I really noticed. But with so much work, I do so much detail work and contract reading in my job that is a main issue. I don't even use reading glasses anymore. I don't wear glasses anymore. I can see distance vision, close-up vision, and middle vision looking at the computer. And usually, I mean, I never wear glasses anymore.
It is a wonderful feeling to make that kind of impact in somebody's life, especially somebody who's working age and very active and able to get back to their normal lifestyle. And many people, these can be incapacitating events that can lead to them not being able to work, not to be able to be independent anymore. And so to be able to make that impact in somebody's life is extremely rewarding.
Obviously, I'm very happy, and I think, you know, not between the doctor and Memorial and the type of care I received, the expertise from both Dr. Sunir and the nurses that care for you, the anesthesiologist, I mean, everybody that's involved in that process, I have complete trust in them and would have no problems referring anybody to Memorial, to the ophthalmology department, the doctors. Everything worked out great for me.
Did you know that people with diabetes are 40% more likely to get glaucoma and 60% more likely to have cataracts?
I hadn't enjoyed reading in quite a while. I used to read like 156 books a year. and I had dropped down to 20.
Lorraine is seeing the difference because of Memorial Hospital's surgical excellence in ophthalmology and more best doctors on the west coast of Florida.
The facility is wonderful. They have all the equipment that we need. It's all up to date. They treat the patients very, very well, and you couldn't get better care anywhere.
Memorial Hospital of Tampa. See the difference. Log on to ionmemorial.com.